In this video, we will go through the role of genetics in cancer, taking a look at Angelina Jolie's experience. You know, years ago, we used to believe that there was a somatic theory to cancer, where everything was genetic. If your mom, your grandmother had cancer, then you were just doomed to have it. But we have now learned that genetics are really only 10% of that equation, and 90% of it is the tumor microenvironment, your lifestyle, your diet, your choices that can actually turn these genes on. So remember, cancer is more of a symptom and is always secondary to the tumor microenvironment. We want to know what's happening around the cancering cell and which messages are being sent these epigenetic changes to turn these cancer processes on. Now we know the famous BRCA1, BRCA2 that Angelina Jolie had inherited, and she decided to have a complete double mastectomy to lower her risk of obviously having breast cancer. But what does that mean for other parts of her body? Because with the BRCA1, BRCA2, you're actually higher risk for ovarian cancer as well. Now, I'm not sure what path she took, but maybe she did remove her ovaries just to completely lower risk of this type of cancer. So what exactly is the BRCA1 or BRCA2 gene? If you do have that gene, you actually are 5 times more likely to have a cancer diagnosis in the breast or ovaries. 85% increased risk for breast cancer, 50% increased risk for ovarian cancer. Men have a 4 times increased risk for colon cancer and a 3 times risk increase for prostate cancer. In this video, I want to go through the top 6 things that I would do instead of having these harsh surgical operations and how I would change the disposition to lower my risk of a cancer process happening. So what is BRCA1 or BRCA2? It is a tumor suppressor gene. And just so you know, we have over 1,000 types of tumor suppressor genes, not just the one. The other very common tumor suppressor gene is TP53. These tumor suppressor genes code for cells that have mutations to actually go into apoptosis. So if your body is making these cancerous cells, our immune system should be able to recognize it and drive it into a cellular death. But if you have a mutation in these tumor suppressor genes, it makes it very hard for your body to recognize that and to control a cancer onset. Now, don't be discouraged, because there's many studies showing how balancing stress and balancing cortisol levels can play a huge role in how these tumor suppressor genes are expressed. All right, let's dive right in. Let's go through the top 6 things that I would do to myself if I knew that I had the BRCA1, BRCA2 tumor suppressor mutations and I wanted to live the longest and healthiest life. The first thing that I would do is have my epigenetics checked. So looking at my genetic profile, understanding which diet I should be on, how my body detoxes, how it deals with stress, which area of my health do I need to focus on. Based on those results, I would be applying an epigenetic protection plan, because even though you have those genes, it does not mean that they're actually being expressed. So someone could have BRCA1, BRCA2 genetic profile and actually never develop a cancer in their lifetime. My top 2 favorite things to supplement with if I wanted to support my epigenetic onset of cancer is selenium and resveratrol. Both of those are epigenetic regulators and can play a huge part in expressing these cancer onset genes, and will help protect your epigenetics if you do have this predisposition. If you're looking to understand your genetics and understand where you want to focus on in your life to lower risk of cancer growth and cancer onset, make sure to go to drlori.ca so we can chat about all the options and ways to help you. The second thing I would focus on is taking a deep dive of my hormone health. You want to focus on modulating your estrogen levels. We know that estrogen is a growth factor, and if we have this genetic predisposition, which increases our risk of cancer growth, then you do not want to load on more fuel to the fire. So helping support how your estrogen is metabolized and broken down, modulating estrogen's receptors can actually keep things at bay. There's a test that I like to run called the Dutch test. which is a test that looks at the metabolites of your estrogen, progesterone, DHEA, testosterone, getting a whole profile of your sex hormones, adrenals, cortisol, how those all interplay. If there's any imbalance there with your sex hormones, then we can integrate a plan to help support the metabolites and to make sure that you're not high in the ones that contribute to cancer's growth. The product that I love to use for any estrogen issue in the body and to help regulate hormones is something called glucoraphanin. And I like to dose that pretty high because when you look at the glucoraphanin content in broccoli, for example, or in all the cruciferous vegetables, you would need to have 3 to 5 pounds of that a day just to equal 1 capsule. So supplementing with things like indole 3-carbinol, DIM, and cruciferous vegetables, all of that will support balancing estrogen and even including more phytoestrogens like higher fiber and flaxseed. The third precaution that I would take is avoiding alcohol altogether. And I understand maybe that's not realistic as a movie star and someone who's in the limelight and a lot of social events, feeling the need to have more alcohol, but there is a drastic increased risk of cancer onset with or without this genetic predisposition. If you do need to have alcohol or you have some and it's just socially once in a while, then make sure that you are supplementing with vitamin B6 and folic acid. Just as a disclaimer here, please do not supplement anything because I'm telling you to. I want you to make sure to work with an integrative doctor, get your blood work checked, get a full profile of your nutrient status, and know what your personalized needs are. If you do not have someone that is helping you already with that, make sure to go to drlori.ca because that is one thing that I absolutely require for everyone is knowing what their blood work looks like, what their estrogen metabolites look like. Let's get the full picture of what you as a person needs versus doing a one-size-fits-all plan. The fourth thing I would implement for just about everyone is to do an annual detox, and a detox that's more focused on xenobiotics. These are chemicals, plastics, pesticides, herbicides, flame retardants. These are all hormone disruptors. And we know that all of these chemicals like to reside in fattier tissue. So by doing a specific type of detox protocol can help extract a lot of the toxicity from the fat cells and eliminate it from the body. So in this case, you want to make sure that your bowels are working well, you're focusing on liver foods and liver supplements, getting circulation going, sweating, all the things that are required to make sure they're actually excreting these things from the body. And we know that our body is so intelligent and is constantly cleaning up on a daily basis. But if we are exposed to these chemicals, then that increases risk of inflammation, puts more stress on your system, and it distracts it from being able to focus on cancer cells, and your immune system can be compromised and not be able to focus on the things it needs to. The fifth thing that everyone should be doing, male or female, is monthly breast exams. It's actually quite common from the patients that I see with breast cancer, they actually find the lump themselves and completely missed by mammograms. The best time to do a self-breast exam is about 5 to 7 days after the menstrual cycle. This is when estrogen is at its peak. If you're not sure what you're looking for doing these breast exams, make sure to talk to someone how to do them properly. You want to get a baseline of what's going on with the breast tissue, what's fibrocystic, what is something to be worried about, and what the signs and symptoms are. An ultrasound will be able to determine if it is something cystic or if it's a solid mass. And then from there, they can investigate further if needed. Because mammograms do influence how much radiation that tissue is exposed to, I would try to limit that. I wouldn't be going for my yearly mammograms. Just think about that tissue just being squished as well, how much stress you're putting onto the body. There are so many other ways to determine if there is a cancerous process happening. Number 6 is all about understanding your metabolic profile. The common labs that I would like to see with everyone, regardless of the genetic predisposition or not, is looking at how much inflammation you have in the body, how well your body's detoxing estrogen, what the estrogen and progesterone ratio is like, and also looking for markers of angiogenesis. So that's a marker for blood vessel growth. If there's cancer there and there's blood vessel scavenging for new sites, then the VEGF would be higher. So that is something you can monitor along with other growth factors like IGF-1, IGF-2. By controlling what the environment looks like in your system, keeping track of your metabolic health, doing quarterly, annual blood work, you can have so much power in this situation. Remember that cancer is really the symptom of an underlying imbalance and dysfunction going on in the body. So if you can do your very best to monitor, make lifestyle changes, and have early signs of inflammation and growth and abnormal growth in the system, you do not have to wait to find a lump. I hope you're feeling empowered by this video and not feeling like you have to have surgery in all of your body parts just to prevent a cancer from happening and to help understand what is going on in your system instead.